Hi, welcome back and thank you for watching. My name is Dr. Brad Fackrell from Straight Chiropractic. Today you're going to be watching a workshop called The Science of Being a Woman. Now you may think, what authority do I have of talking about the science of being a woman, being a male? Well, in this workshop we talked about a lot of the female issues. One that is really most pressing in a lot of female is osteoporosis. A lot of women that I talk to, they talk about their mother or their grandmother and that hump that they have in their back and how they do not want to get that hump. Well, today's workshop we talk a little bit about that and about how you can prevent that. So enjoy this workshop.
Hi everybody. Hello. Welcome to our Mother's Day Special Women's Issues Workshop. I'm so glad that you can make it. I know for myself, being a mother, we have certain issues that are a little bit unique to being a female, and that's why I was so excited that Dr. Brad decided to do this workshop tonight, to find out more about how I personally can help prevent osteoporosis. You know, I see some of our patients come in and it just saddens me to see the shape that they're in and that they didn't know about chiropractic when they were younger. And I don't ever want to get to that spot. And I hope that you guys can share that message with your friends as well. So I'm just really glad you guys are here tonight. It's great to have all women, isn't it? Are you guys loving this? We do rock. I love having all these strong women here tonight, and I'm so glad you guys choose to come, if I can talk, to find out more about how to improve women's health, because we need it. So with that, here's Dr. Brad.
I am also very grateful to be here tonight, and I want to start by sharing a story about one of our patients. Her name is Evelyn. Some of you may know Evelyn. She is 80 years old, and she is an amazing lady. She teaches piano to some of my kids. She teaches voice lessons. And when I first met her a few years ago, she literally was bent over like this. And when I talked to her, she would just try to straighten up, and she'd go right back down there again like that. She could not straighten up, and she was in so much pain. She had been told by her medical doctor that she was beyond help and that her bones were too brittle and too weak to have any type of surgery. And thank goodness for that. I mean, it was a blessing to her to not have to go through that surgery, because she would have done it because she was pulling for straws. She didn't know what else to do. What's been so awesome to see happen over the last couple of years is the transition to where she stopped using, oftentimes she will come in without a cane, but she stands upright. And she can lay down on the table, and you know, she's still got a lot of problems, and she will never be perfect again because she found out about chiropractic too late. But she's so much better than she used to be. Her quality of life has improved. So what I want to share with you tonight is how you can improve your quality of life and never, ever have to end up like Evelyn. And she will be the first one to tell you to just follow our recommendations and just do the right things and prevent it from ever happening. You guys with me on that? Mm-hmm. Amen. So one of the keys to aging gracefully is to enjoy life. Now, who likes, raise your hand if you like chocolate. I absolutely love chocolate. And so tonight's workshop could be a little stressful for some of you. You may learn new things that you think, oh my goodness, I haven't done this my whole life, or oh my goodness, I'm going to have to change some things. Who knows what the stress could be caused from tonight, from this new information. And so I wanted to make it really easy on you. And so Diana, go ahead and start handing out the chocolate. You know what, she's just going to give Vicki the bucket here. And we have plenty, so we have another bucket, don't we, or do we? Is this... Well, On your first go around, just take one, just so everybody gets one. Now, for those of you who are doing the weight loss program, you know, and you want to skip one, it's okay. But you know, anyway, this chocolate. There's a reason why I'm giving you chocolate tonight. You know, there's a very important chemical that is released when you eat chocolate. Does anyone know what it is? It's the stress reducer hormone. Does that help anyone? It's called serotonin. You got it. Serotonin. That's what I love about chocolate. Because it helps to release some serotonin and it helps you feel good. So when you're in a stressful situation, that's why it's normal to crave chocolate. Because it has both fat and sugar. The two things that we need when we're under stress. Actually, what our body thinks it needs. And that, I'll leave the rest of that discussion to our stress workshop that we're going to be having in December. But for the time being, if you'd like a piece of chocolate, have some chocolate. Because, you know what I have found, I'm very blessed. My wife, who's heard of something called PMS? Okay, now I got to be really careful here because I am a guy. You know, we are outnumbered tonight, and so we got to be really careful how I say things. So, because I understand that PMS can be kind of a touchy situation, and so it's especially helpful sometimes to have a little bit of chocolate during that time of the month when maybe you might be having a rough time. In fact, it's been told to me that PMS can actually have multiple meanings. And so I'm going to go through a couple of these meanings that kind of, you know, might make sense to you. I don't know. Pass my shotgun.
That's a good one.
Perpetual munching spree. Puffy midsection. Now again, I apologize. I didn't make these up. I'm just sharing. Provide me sweets. I like that one. Pardon my sobbing. Pimples may surface. That's for my teenagers. Pass my sweatpants. But here's the ultimate. This is the best one that I find, you know, really could be realistic for some people. And I fear and I just, my heart goes out to those men. Because potential murder subjects, suspect. So, it doesn't have to be like that. In fact, not everyone has to feel like this. It's a reality, isn't it? Raise your hand if you've ever felt like that. So, like murdering somebody. So, it doesn't have to be like that. In fact, there are plenty of people, and there are probably some of you in this room, who can honestly say, you know what, it's not that big of a deal. I'm just guessing, I don't know. It's not as big of a deal. I have to be very sensitive, I apologize. It's not as big of a deal as I see it in other people. And so we're going to talk about some of the reasons why it doesn't have to be as big of a deal. Because simply by creating balance can be created when interference in your nerve system is removed. It's really that simple. If you understand that your nerve system controls every operation, every system, everything that's going on in your body, and when you simply remove the interference, an amazing healing can take place in every part of your body. You know, in fact, it's been wonderful to see some of our patients who have had awesome things happen regarding their cycle becoming more regular, and easing. And what's really been cool is to see some of our patients that have had literally miracles take place regarding reproduction. Let's see, Ginny, you might be the only one in the house that remembers. Carol, you might remember. Nope, you won't. Mary Jo Schlanger. Do you remember Mary Jo? In my first year of being in practice in my old office, when we first moved here to New Mexico, Mary Jo came to work with me. And when we were interviewing, she told me, she says, you know, I really would love to be able to get pregnant. But my husband and I, we have spent out of our own pocket over $10,000 to try to get pregnant. And that's on top of what the insurance company had paid for them. And I can't remember, I believe it was something like 7 or 8 years that they had been working to try to get pregnant. They really wanted to be able to have a baby, and they weren't able to get pregnant. And so we hired her, she started the job, and everything was wonderful. We started adjusting her because that's simply what we do here. And within 2 months, guess what the announcement was?
She's pregnant.
She was pregnant. And you know what? She was doing absolutely no intervention at the time. She had spent so much time, so much effort, so much money, and she hadn't been able to get pregnant. She gets adjusted, and within 2 months, she's pregnant. Isn't that cool?
Yeah. In fact,
She had lost 2 babies. She had lost 2 babies. Yep. And what's even better is when I had my office in Kansas City, the exact same thing happened. I hired somebody, told me she couldn't get pregnant. Within 3 months, she was pregnant. And then, of course, we've had multiple people who have come in as patients and who haven't been able to get pregnant, and they're able to get pregnant. Why does that happen? Well, it's because we remove the interference. The body can do what it's supposed to do in many cases if we just simply remove the interference. So, one of the problems that we, and I'm not just talking to the women now, but it's to all of us, one of the problems is that we oftentimes don't think about our health. In fact, Margaret Ann, if I can use you as an example, today when you got adjusted, you showed me one more thing that you've been able to do, one more miracle, one more accomplishment that you weren't able to do 8 months ago before you started getting adjusted. In fact, 8 months ago, you could hardly walk.
I couldn't see.
And you say it again?
I couldn't see either.
That's right. That's right. And she'd been diagnosed with diabetes. So you were on, like, was it 8 different medications? 8 different medications. And now 8 months later, how many medications are you taking?
0.
0. Let's give her a hand for that. She's available for autographs later. So, when you were younger, did you ever picture yourself being older and being in the position that you were? Not being able to function?
No.
You probably felt like everything was fine because you felt fine, right, at the time. But your health slowly got worse and degraded, and to the point where you could not walk. You were in a wheelchair at a time. And so when you were younger, you didn't even think about your health. Raise your hand if you go throughout life and every day you may just wake up and you never even think about your health. You just think, oh, life is good. That's the way it should be, right? But on the other hand, wouldn't it be better if you felt that way and you thought about your health? Well, here's what I'm sharing with you. Every one of you are here because you think about your health. You are being proactive. You are doing something to be in a better position. Not just today, but 10 years from now, 30 years from now, and for some of you, Carol, 50 years from now, right? So, if you find yourself thinking negative things about your health, and maybe if you're in a really rough spot and you're dwelling on those rough things, well, part of the battle is simply being able to think about something different, because your mind is so powerful. And if you're in a position to where you can physically think about something else, one of the best things to do is to, and you find yourself that you're having those negative thoughts, pick up a ritual. Start a ritual that you can do for yourself to get your mind off of those negative things. And one of the best things to do to distract you will simply be exercise. Exercise has multiple benefits. In fact, Marcia, could you come up here for a minute, please? So I have invited Marcia to be here tonight because she does something that I think, ever since I met her, I've been impressed with her her fitness level and her desire to be strong and physically fit. So I'd like to give Marcia just a moment to share a little bit about what she does.
Thank you. Hi, my name is Marcia Fife, and I'm with Jazzercise Rio here in Rio Rancho. Can you hear me out of the mic? Okay. I'd like to say thank you to Dr. Brad for letting me say a few words to you. At Jazzercise, what we do is we're a total body workout program. We utilize, we're a dance-based exercise program where we work your heart cardiovascular-wise, and we also provide strength training. With the strength training, we utilize dumbbells, balls, and resistance tubes. And you've probably heard a lot of good things about strength training, about how it helps you with your functional fitness, how you can do everyday things without hurting yourself. You know, you can reach down, pick something out, you don't throw your back out. Also, another really great thing about strength training is that you have the opportunity to improve your bone density. And you may ask, well, doing strength training, how does that improve my bone density? So what happens is that think of your skeleton as being the framework for your body. It's the base that everything is laying on, your skin, your organs and everything. So what happens is when your body gets extra load, it gets an extra load for weight, innate intelligence, big buzzword here, innate intelligence, it kicks in and it makes the framework stronger so it can support the extra demand that's on the body. So I want you to think of your bones as being alive. They're organs just like your heart, just like your skin. And so what happens with the framework of your bones, when you take weight and you put it on the bones, you have new bone tissue that starts to develop. And again, that innate intelligence, it kicks in again when you have that, and it builds new bone tissue. And I want you to think of it as if you're on the beach and you're building a sandcastle, you take water and you take sand and you reinforce the walls of your castle. That's what happens to your bones when you do strength training.
Awesome. Let's give Marcia a hand. So thank you for that, Marcia. And what's so awesome about that is the fact that innate intelligence does kick in. All we've got to do is do our part to help it along, to give the right information so that our body can adapt the way that it's supposed to. And on exercise, I just want to share this one thing because a lot of people think, oh, I just don't have time for exercise, or, you know, there's so many things that I have going on. And you need to understand it releases so much stress to do it. In fact, some time ago, when I was younger, I had a whole bunch of work that I had to get done, and one of my buddies called me, and he said, you know, Brad, we really need to go on a bike ride. And I thought, oh, I just can't. I've got this mound of work to do. And he said, wait a minute, just take a break. He says, because there's absolutely nothing that has to be done today that can't be put off till tomorrow. So, sometimes that's true. Sometimes you need to just take a little bit of time for yourself. Somebody once told me that our life should be lived by these three things. Remember the past, live for today, and prepare for tomorrow. Remember the past, learn from the past, in other words, use our history to shape us. Live for today, play full out, live your life, enjoy it. Eat a little chocolate every now and again, and prepare for tomorrow. Don't eat too much chocolate today, because it'll affect tomorrow. So, you know, one other thing regarding exercise, why do we exercise? It's to look good, right? That's why we exercise. You know, Marcia talked all about these, you know, things like, you know, actually being healthier. But really, bottom line is, don't we exercise to look good?
That's the first motivation.
That's usually the first motivation. Let me share this with you. Has anyone here heard my story about my neighbor's rabbit? Good. Because, see, Lyndon remembers now. So I came home from work. This is when I was back in Kansas City. And I came home, and we had our dog. And my dog's name is Atlas. Kind of a cool name, isn't it? She's a black lab, so she's pretty big. She was a young pup at the time, though, a big pup. And she wasn't as obedient at the time as she is now. And so one night I came home, and Atlas had our neighbor's pet rabbit in her mouth. Now, obviously, this was a little disconcerting to me. I thought, this isn't very good, and so I quickly went over, because this rabbit, for this lady, oh my goodness, this was more important to her than any kids she could have ever had. I mean, that rabbit was the world to her. And so I knew this was a big thing. And so I quickly went over to Atlas and I said, leave it, leave it. And, tried to get the rabbit out of her mouth, and she finally let go, and I realized it was just too late. And it just killed me. I just thought, oh my goodness, how am I going to deal with this? Now, I was young, I was inexperienced, I was maybe a little stupid at the time. And so I had an idea, because I am very smart. So I got, I took the rabbit out of the mouth, and it was just all covered with slobber and dirt, and it just looked terrible. And so I thought, being the smart guy that I am, I'll take it inside, and I'll just get a little shampoo and wash it, make it all look fluffy. And then I got the hair dryer out, and I sprayed it. So his hair was all fluffy. It looked really, really good. I was very proud of myself. I had made this rabbit look great. And so I took it over to my neighbor's porch, and I set it on the front porch, thinking, she'll come home, and she'll see the rabbit and go, oh, my goodness, what happened here? So I go back in the house, and I'm just waiting. I'm kind of watching out, making sure, when I see her come, I want to be close just so I can, catch something if it's going to get killed or something. And I didn't hear anything for a long time. I didn't see her. For some reason, she was really home late from work that night. And I waited and waited. And finally, I just forgot about it. Until I was putting my kids in bed, and I heard this blood-curdling scream. Ah! And immediately it clicked. Ah, yeah, I remember. And so I ran outside. I said, what's wrong? What's wrong? She's my rabbit, my rabbit, my rabbit. I said, what's wrong? What's wrong? She said, no, you don't understand, my rabbit, my rabbit. I said, what's wrong? It looks dead. I'm my rabbit. She just kept saying, my rabbit. And I says, I'm so sorry. I'm so sorry your rabbit died. She said, no, you don't understand. My rabbit died last week, and I buried it, and it came back to life, and now it's dead again. You see, it's not always just what we look like. We can look great on the outside, but if on the inside we're dead, we're dead. And by learning the principles from tonight, you can learn how to increase the life and extend your life. So that really didn't happen, just if anyone was wondering. So what it starts with is movement. And one of the benefits of exercise is movement to the spine. Because what happens is there are these little nerves that come out from in between each bone in the spine, and it sends a message up through the spinal cord, and then that attaches to your brain. It's a wonderful thing. What happens is there are little receptors right at the nerve root. They're called mechanoreceptors. What happens is if these bones move, which every time you move like that, as long as all those bones are moving, you're having a stimulus take place at the mechanoreceptor, which sends information up through the spinal cord into a part of the brain that creates what's called ATP. Anyone ever heard of that before? It's the energy. It's the energy that every cell in your body needs to perform its function. All of the ATP that actually drives the function of the other cells that make ATP, because most cells do make ATP, all of that comes from this one area in the brain that happens because of motion to the spine. It's a beautiful system that God created because He knew that as we move, we're going to stimulate that and we're going to have all the energy that our body needs. So, how does subluxation play into that? Well, if those bones stop moving, what happens to that mechanoreception? Stops. It absolutely stops. And so by simply, if you've got subluxation and you get movement to take place in those joints, that's one of the reasons why people get well and why you feel more energy when you get adjusted, because you're creating that. Now the goal is, as you get adjusted, to create stability in the spine so that you can move all the time without having to get adjusted every day. You can hold an adjustment for a week without having to get adjusted. You can do your own spinal hygiene exercise. You can do your exercise, and every time when you move, because you have proper stability in your spine, you are moving, creating the energy that your body needs to live. One more thing that movement does for you in regards to the disc is this disc is made up of mostly water. And yet, it doesn't have any blood supply that goes into that disc. It's cartilage, which is made up of 70% water. Yet the bones and the tissues around it are very nutrient-rich, and they're very hydrated. And so, and they have blood supply going into them. So what happens with lack of movement to that joint is the disc will start to become dehydrated because it can't suck water into it. Because what happens is that joint simply moves. It acts like a pump, and it sucks fluid into the disc through a process called osmosis. And as it sucks it into the disc, it will keep the disc thick and healthy. Guess what happens when that bone or that joint stops moving? What happens to the osmosis? It dries up. The disc is going to dry up. It's going to dehydrate. And so, as most of you have already seen, as that happens, you get a totally dehydrated disc like that. And of course, we call that arthritis or osteoarthritis. Bulging disc, herniated discs, degenerative disc disease. Those are all things that are caused because of lack of movement to the joints. So, my question is, when should we start thinking about making sure our spine moves properly? Today, or yesterday, or years ago, right? And for our children and our grandchildren, the same thing. You see, it can be prevented, but once this problem is there, it can no longer be prevented. It can only be dealt with. And so obviously it's better to keep it moving so that we can have good health. This is one of the reasons why it's so important to get adjusted once a week for life. Because we do things, excuse me, we do things every day that will cause subluxation, will cause stress to the spine. And what we need to do is just simply think about our health every day. Now, I also want to touch on osteoporosis. Osteoporosis means that our bones are more prone to having fracture. So what osteoporosis is when the density of the bone just simply decreases. Now, Sarah, we just had a chat with her and her husband a couple of weeks ago. And Sarah, you've been a chiropractic patient now you're going in your 4th year, is that right? Now, what was so, and I'm not going to bring you up here, if it's all right, I'm just going to share a little bit about your story. So correct me if I'm incorrect on anything. Sarah, when she first started care in our office, it had been 17 years, am I correct there, that she had been getting her bone density checked. And she had found that she was losing bone density. And every year when she would go, she would be a little bit less dense in her bones. And it was a concern to her. They had put her on some medications, and then she kind of stopped taking some medications. But she was monitoring that all the time. The great thing about it is as she started getting adjusted at the end of her 1st year, she went back in, had her bone density checked, and guess what happened to her bone density? Yeah, it had gotten better. Just by getting adjusted. Now, if I remember right, you hadn't really made any other changes in that year. It was simply you added adjustments into a lot of already good, healthy lifestyle living. One of the reasons that happens is because one other unfortunate thing, if you saw the article today, it showed the hump in the back. Well, see, that's what happens because of osteoporosis. The bones get very weak, and so they will literally crush or compress, and you get that hump in the back, which is, of course, made worse because of forward head posture. So by preventing forward head posture, or dealing with it when you're younger, by dealing with the things regarding osteoporosis, you can minimize the negative effects of that. In addition to that, Has anyone heard, now the reason why all that happens is because of cellular stress. Again, in our stress workshop in December, we'll talk about the physiology of all that. There's a hormone released, or chemical released in your body whenever your cells are under stress called cortisol. Anyone ever heard of that? In fact, have you heard there's some drugs that can help regulate that for you? Why not just let innate intelligence do its job and fix the causes? But bottom line is, there was a drug that was given to a lot of people. In fact, I think a lot of people still take this drug called Fosamax. Anyone heard of Fosamax? Yeah, that's been in the news lately. Remember what happened to Fosamax? Or what, I'm sorry, what happens to what is a potential problem for females that take Fosamax for 5 years or longer. How long do they usually leave you on those drugs? Is it longer than 5 years? Yeah, as long as you'll take them for the rest of your life, right? Because that's what makes the pharmaceutical companies money. So this Fosamax, unfortunately, causes fractures in the femur. And, you know, it just comes out. But if you understand the principles of how innate intelligence works, then you can learn whenever there's any type of drug, if you can just prevent yourself from having to take that by living a different lifestyle. Doesn't that make more sense? Learn how to do something to prevent becoming sick. So, in fact, Marcia touched on this briefly. There is this lady that I read an article about. She and her husband lived on this farm, and they had worked their whole life just, it's hard work. Is there anyone here that has lived on a farm? Okay, a few of you. I grew up on a farm, and you know, it's hard work, isn't it, Jackie? In fact, at 70 years old, do you want to be running a farm? No. Of course not. At 19, I said, I'm done with the farm. So this lady, she was every day hauling the hay, going out and feeding the animals, digging ditches with her husband, you know, digging post holes, doing all the hard, heavy labor with her husband. And finally, when she got to be 70 years old, she just said, look, honey, I have had it. I don't want any more to do with this. In fact, I'm going to prove it to you that this is not good for my health. I am too old to be doing this hard, heavy labor. And so she scheduled an appointment to go see the medical doctor. She'd never seen a medical doctor. And she scheduled this appointment to go see the medical doctor. And she was going to prove to her husband that it was weakening her body and weakening her bones to work so hard on the farm. So she went to the medical doctor, and she did all the tests, and the results came back. And guess what she had to tell her husband? She couldn't get out of it because the hard physical labor actually strengthened her bones, just like Marcia was talking about, and helps keep us healthy. Do you know that if we don't use it, we will lose it? So that's why it's so important to allow, to stress our body, to work it, to be strong. So one more very, very important thing, which is why I believe every teenage girl needs to get this information. Because most teenage girls like soda pop. In fact, some adult girls like soda pop. In fact, a lot of adult males and kid boys and everything. Soda pop tastes good. It's sweet, but it's full of garbage. But there's one specific chemical in it that directly affects osteoporosis. It's called phosphoric acid. The phosphoric acid, if you didn't even count all the other garbage that's in the soda pop, the phosphoric acid leaches the calcium, and it increases your chance of having osteoporosis when you're older. And it's most critical during the growing years. So if you have teenage girls, if they really like soda pop, tell them they can't have it anymore. It's their life, and they will thank you later. So, in fact, that's why what the article today talks about. So if you didn't grab that, grab it on your way out. So again, life is good. Remember all the good things. Remember the past. Live for today. Make choices for tomorrow. And preserve your life. Which leads me to this final note. Everyone has heard of our pamper party that we're having this Saturday, right? If you haven't heard about the Pamper Party, I want to take just a moment and share it with you. My wife is a perfect example of service and love and giving her all for everyone else. In fact, she is the last one to take care of herself. Now, I believe that there are probably most of you in this room, because I'm talking to women, and it's by nature, that that's what you do. So, we have designed something especially for you and the people that you are closest to. Our Pamper Party that is this Saturday from 11 to 2, you have an opportunity to bring your friends in, your female friends, leave the guys at home, leave your husbands at home, bring your female friends in. We're going to have haircuts. We're going to have makeup. In fact, Jill, you're going to be here for doing some Mary Kay consulting. We're going to have makeup touch-ups from Callis Beauty Institute. We're going to have free chair massages as well. Everything is free, by the way. It's a time to be pampered. And for those of you who have not yet had a chiropractic exam to check for subluxation, to check to see and make sure that movement is happening, or you have friends that you feel like it would be a really good idea for them to get checked for subluxation, bring them along with you, because they also will get a new patient exam at absolutely no charge. The idea is for you to take that one day for 3 hours and pamper yourself. Do something for you. And I am excited to be able to share that with you. Our team has been working for this and working on this, and we're really looking forward to it. I thank you for being here tonight. You guys are awesome. Welcome back. I hope you got some great insight onto how to preserve your future health as a woman. Osteoporosis, as we talked about, is a big issue. You can make a difference in your future health. You can make the difference in the future generation as well. It's your obligation to do that, as it is mine. So your homework for today is really quite simple. Make some kind of nutritional change or exercise change or whatever insight you got that kind of hit home with you. Just start making that change. But the biggest thing that I want you to do as homework is to share this information with somebody else, somebody you love, somebody that you care about, somebody that you can make a difference with. And until next time, live your life and help them live theirs to the fullest.